Hello and welcome to NHIS in a week. Here we give you highlights and happenings in the authority and the scheme. My name is Efia Cherma. Now the headlines. Stakeholders applaud NHIA ICT innovations. A delegation from Roche Pharmaceutical Company visited the National Health Insurance Authority in Accra to welcome the new chief executive. And NHIA partners with National Blood Services on blood donation drive. Now the news in details. Stakeholders at a recent engagement in Kumasi praised the ICT innovations by the National Health Insurance Authority, highlighting the growing appreciation for technological advancements in healthcare. The NHIS initiatives aim to improve service delivery, enhance data management, and increase efficiency with the healthcare insurance system. The National Health Insurance Authority, in partnership with the National Blood Service, organized a successful blood donation drive at Teshi Camp Methodist Church. This was in collaboration with the 48th Engineer Regiment in the Kweshi district. In attendance was Mrs. Louisa Atta Ajiman, the Deputy Chief Executive Officer of Operations at the National Health Insurance Authority.
This is an exercise that we've been embarking on annually, and I'm so happy with what our Regional Director, Madam Patient, has done so far in collaboration with CAF. I think it's going on well. After seeing what is happening here, it's impressive. We have the support of the Army officers and then the school children who are all registering. This is our support for the nation building and also especially towards this community.
Mrs. Louisa Atta Ajiman expressed her delight at the partnership between the NHIA and the National Blood Service.
Today, I'm so happy to be here looking at the partnership we are doing with the National Blood Service.
We are here in partnership with the NHIS today for a blood donation exercise. There is the growing need for blood to be donated regularly because there genuinely isn't much to go around these days. And we are in partnership with NHIS pushing the agenda to save lives by donations. It doesn't take much to donate. Once you are between the ages of 17 and 60, above 50 kilograms, and of good health and sound mind, you can donate.
This event was part of the ongoing celebrations marking the 20th anniversary of the National Health Insurance Scheme, highlighting their dedication to saving lives and supporting communities.
As part of the 20th anniversary celebrations, we are here to partner with the National Blood Service and to donate blood and then also to save lives.
The executive management of the National Health Insurance Authority has embarked on a rigorous publicity for preventive healthcare, citing how essential it is in the chain of healthcare delivery. As part of a grand agenda proposed by the Chief Executive, Dr. Da Costa Abuaje, all residents in Ghana are to benefit from a free annual medical checkup at NHIS accredited facilities.
What we want to do is to introduce the preventive aspect where we give every Ghanaian the opportunity to go to any healthcare facility of their choice to do a medical check once a year on their birth month.
Okay.
On their birth month.
Okay.
Dr. Samuaba is chairing that committee. Very soon it will be completed and will roll out. That's part of the comprehensive plan that I've been talking about.
These were part of the remarks he made on PM Express with Aisha Ibrahim on Joy News. Also in the news, the Deputy Chief Executive Officer in charge of operations at the National Health Insurance Authority, Mrs. Louisa Atta Ajiman, visited the Greater Accra Regional Office to commend staff for their loyal and dedicated service. During her visit, she acknowledged the staff's hard work and highlighted the significance of the NHIA-NIA collaboration project to register children under 15. She also used the opportunity to urge staff to ensure the project's success. A delegation from Roche Pharmaceutical Company here in Ghana, led by General Manager Kotaso Mutumi, visited the National Health Insurance Authority in Accra to welcome the new Chief Executive, Dr. Da Costa Abuaje. They congratulated the Chief Executive on his appointment and commended the NHI Executive Management for their initiative to cover the cost of dialysis care for vulnerable Ghanaians.
This morning, Rush came to the National Health Insurance to officially welcome the new CEO, Dr. Abuaje Da Costa. Since 2019, Rush has had a partnership with the National Health Insurance that has contributed towards improving access to over 1,000 Ghanaian women when it comes to breast cancer treatment.
Officials discussed potential collaborations on the NHIS preventive healthcare initiatives.
The experience when it comes to preventive healthcare, particularly in oncology, in the areas of HPV, are areas that Roche is very strong in. And we are happy to partner with the NHI, the Ministry of Health and other stakeholders to ensure that early detection and prevention of cervical cancer is enabled by appropriate screening and diagnostics.
The Bono East wing of the National Health Insurance Scheme has joined some other regions to intensify its campaign on wellness as a means of projecting preventive care to the fore in the healthcare delivery system in Ghana. This initiative, led by the Chief Executive of the National Health Insurance Authority, Dr. Da Costa Abuaje, focuses on promotive and preventive healthcare, where every Ghanaian would benefit from a free healthcare checkup once a year. According to the CEO, this will aid in the early detection and treatment of medical conditions. The National Health Insurance Authority, in collaboration with the University of Ghana Business School, UGBS, and the Korean Foundation for International Healthcare, KOFI, began a 5-day executive training program for its third cohort of participants from June 24th to June 28th, 2024. The objective is to educate participants to better understand the healthcare financing system and governance, particularly in African countries.
Hey, Swagger, what's up?
How far with your internship?
To be honest, I'm so nervous about starting this new role on Monday.
Oh, please. I know you'll be great at it. You should be worried about what benefits they have. Example, do they have health insurance?
I doubt they will have that for interns. But no shaking. I have NHIS already.
After you son a line, ting.
Ina, look at you. What are you going to do in the office when you can just download their app to register for an NHIS membership?
Yes, my people. You heard right. You can now download and register your membership on my NHIS app. No long queues or tedious paperwork. All you need is your Ghana card to register for yourself and for others. Once you register, you get a new digital NHIS card on your phone. My NHIS app gives you access to credentialed health facilities and services across the country. NHIS covers over 95% of disease conditions in Ghana. Access to healthcare just got easier.
Now let me sign up quickly. Me, Seth, I'm starting work next month.
And this is how we wrap up on this week's edition of NHIS in a Week. Kindly log on to our website www.nhis.gov.gh for more stories. You can also subscribe to any of our social media channels displayed on your screen. Thanks for watching.